Okay, so welcome everybody to this instruction about compassion fatigue. You may wonder why this is an important topic, and we're going to go over that in this lesson, why compassion fatigue is such a prevalent problem with ER nurses. It was discovered in 1992 that some nurses had literally lost their ability to nurture, and so that's what got this started. If you watch along on the slides, this next slide shows our course objectives. We're going to learn the definition of compassion fatigue, the signs and symptoms of compassion fatigue, the strategies that we can use to combat compassion fatigue, and assess our personal needs related to self-care. Self-care is one of the best things that you can use to combat compassion fatigue and get back to where you were when you first started as a nurse. We are going to identify some personal needs for self-care and maybe even 3 signs or symptoms that you may be currently experiencing in your life. We're going to learn how to apply a couple of techniques, which are deep breathing, yoga, and guided meditation. And then I will have you select something that works the best for you in your life. So, compassion is the sympathetic consciousness and desire to help those who have experienced emotional or physical distress and or misfortune. And when we think about the reason why we became a nurse in the first place was because we're compassionate human beings. We care about other people. We had an idea when we filled out our application for nursing school as to why we wanted to be a nurse and what that meant to us. And a lot of it had to do with compassion. We wanted to help people on their worst days. We wanted to help people um, see better health and be more independent. We wanted to nurture and to care about other people. And that's what compassion is. The opposite of that is compassion fatigue. And that results from caring for those who are suffering, facing a traumatic situation, or have undergone tragedy. And this happens because we're having these traumatic events ourselves over and over and over again without any break. We just constantly, especially in the ER, we go from one crisis to another, whether it's the crisis of the patient or the crisis of, you know, the corporation or our boss or our leader that needs us to do something. There's always something that gives us the feeling that we're either not doing good enough or that we need to do more or that there's a crisis here and a crisis there, and it's just too much. And in our situation, we run codes. We can be running a code 1 minute and the next minute go to a room of somebody who's got a cold, and that is hard to compute. That you literally are trying to save somebody's life, and then somebody else is having what we see as a minor problem, and that contributes to the compassion fatigue. What else? Other things that contribute to compassion fatigue is what we see a lot of times is when people manipulate us and demand certain things from us or want a particular type of drugs and things like that. And that just wears on you after a while. And then I want you to think about what's going on in your own life. Are you caring for people at work for 12 solid hours and then going home and caring for people at home? Do you have children? Do you have an elderly parent? Do you have somebody else in your life and that you need to care for? And we all probably do on some level. And so when do we get a break from that? And a lot of us don't. And that also contributes to compassion fatigue. So you may ask yourself, what are some of the signs and symptoms of compassion fatigue? And according to the American or the Emergency Nurse Association, they've broken it down into 3 categories. And those 3 categories are psychological, physiological, and workplace. And we'll go over what the signs and symptoms are so that you can have a better understanding of where you may be in your life and how you may be feeling. You may not even know that some of the feelings that you're having are related to compassion fatigue or burnout. A sustained time of compassion fatigue actually causes burnout. So before we took this class, we filled out a compassion fatigue survey. In our department, even though we aren't one of the busiest, we scored very high on compassion fatigue. We weren't quite to the burnout, but a lot of us, about 80% of us, had compassion fatigue. And you have to think about the reasons why. So, some of the signs and symptoms are psychologically is anxiety, avoidance, depression, hyperarousal, memory problems, poor concentration, poor judgment, restlessness, mood swings, intrusive thoughts, lack of compassion, and numbness. When we think about that in our own life, um, sometimes we have poor concentration, we can't remember things, or we walk into a room and we think, why did I come in here? I can't remember what I'm doing. The lack of compassion is obvious. You just get to a point where you're just like, I really don't have anything else to give. And if you imagine the analogy of like a bucket that's filled with water, that is the essence of who you are. You cannot give anybody from that bucket if there is a hole in it and it's leaking water or it's completely empty. So keep that in mind as we talk about this, because at some point we need to know how to make it better and how to refill our bucket so that we can continue serving in the capacity that we wanted in the first place when we first started becoming nurses. So the depression and the hyperarousal anxiety and the avoidance are some things that we do often. And avoidance of social situations or avoidance of particular patients or patient populations. So a few weeks ago, we were involved in a pediatric code. Most of us were. And even though it's been weeks, it's still on our minds. And we can still do things and we can still have intrusive thoughts. And those intrusive thoughts can include things like, I could have, I should have, or I would have. And if I could go back and I would have done it this differently, and I wish I would. And while sometimes that's really helpful, sometimes it can be too much. So keep that in mind and think about your psychological health and well being. And is it affecting you physically? So, physiologically, it can cause fatigue. And I think most of us have the fatigue. Muscle tensions, which can, for me, translate into migraines, gastrointestinal problems, headaches, cardiac symptoms, and sleep disturbances. And sleep disturbances can run the gambit from not being able to fall asleep to not being able to stay asleep or being excessively sleepy while at work. And that is because you've been dealing with something emotionally burdening for so long without taking care of yourself. The workplace signs and symptoms, this would translate for a manager would be high absenteeism, frequent use of sick days, lack of joy in work. You see your coworkers becoming apathetic. They just show up for the paycheck and it's no longer I'm happy to be here and I'm grateful to be a nurse and look how far I've come and who can I serve today. Lack of empathy towards the patients, a decrease in productivity where it's hard to be proactive and get up. You just would rather sit down. Increased turnover. So the ER can't retain people for more than a year or two at a time. And then avoidance in working with specific groups of patients, like we talked about. So if somebody was directly involved in a code of, let's say, a pediatric patient, and that was particularly disturbing to their peace, maybe because they have a child at home that same age, or maybe they had a past trauma with that, they may avoid that situation altogether or um, that group of patient, that population. And I know there's several of us who say, I can't do pediatrics or I can't do this patient, they're triggering for me. And that is actually a very healthy thing to do. And it's sustained over a long time. You need to observe and wonder why that's happening and then take care of yourself. But working as a team and helping one another out is very helpful, and that's what we should be doing. So, how do we combat compassion fatigue? What are some steps for us to take to make it better for us? The ENA suggests that we participate in meditation, sleep, exercise, healthy personal interests, and self reflection. Self reflection is that thought process and the thinking of why did I become a nurse in the first place? Why did I choose this profession? Why did I want to serve other people? Healthy personal interests can be like CrossFit lifting weights, going to the gym, watching movies. And then meditation can come in many different forms as well. You can do some guided self meditations. You can download them right off of iTunes and listen to them at night while you're falling asleep. I'll teach you a very easy one at the end of this course that you can do to help you fall asleep and sustain that sleep. And then with the sleep, we can take some melatonin, we can set the hygiene of our room and have good sleep hygiene. The lights dimmed, no computer or electronics in the room. The room is cool and dark. And those are some things that will help us to sustain our sleep so that we have more energy when we do go to work.